Okay, so we're back to stage 2 now. So we've about to find out about stress and its effect on health. So chronic stress or chronic arousal, or it could be high levels of stress, could all be some of the terms that get used in the types of questions if you have a look out to the right for this part. So you need to understand that all of those sorts of terms could be used, but what it means is that the stress that a person's under is ongoing, so that they're stressed, if not all the time, at least most of the time. So one of the things we can use here to help explain what happens when our stress levels are chronic is the general adaptation syndrome. So I've got a little picture of it down here. This is the one from the textbook. So what you need to understand is that there is a line going across here, which is our normal level of resistance to stress. What happens if we have something stressful happen is initially our level will dip. So there's a stress that comes and hits at this point in time, and our body has a little bit of a panic before it starts to fire up. So that's why there's a little dip here in our ability to resist stress. So the first phase at that point is called the alarm phase, where we are releasing hormones of adrenaline and cortisol and energy so that we can actually deal with that particular stress. Then our body goes into the resistance phase. So this is where your body keeps those level of stress hormones very high so that we can deal with whatever it is that's a stress. Now, if it's continuous stress that the person is undergoing, you can see that releasing all of these hormones and huge amounts of energy are going to be not able to be maintained for much longer. So eventually what happens is our body reaches exhaustion because all of our resources have been depleted. And so what happens is you can see that on this graph, your ability to be able to resist stress diminishes quite much to quite a bit lower than what it was before the event. So in this part, this is where your immune system's not starting to function as well as what it should be, and you become more likely to get simple illnesses such as cold and flus or headaches. But the long-term thing, which is the scary part, is that if you are constantly in this stress state, that you're going to be putting a lot of wear and tear on your heart. So disorders of like cardiovascular disorders are going to be more common, like heart attack and stroke, because your body shut down blood supply to your digestive system because of the high levels of stress. You're going to have more chance of having digestive disorders. Cancer is another one that's linked to high level of stress because your immune system's not functioning as well. And psychologically, there is some effects as well, mental health issues, including anxiety and depression. And it can mean people are more likely to do things like smoke, drink, have a poor diet, and not exercise enough. All right, the next one is principles in relation to shift work, which I'll cover down a bit lower. All right, psychological interventions, including psychological interventions to, let me just go down a bit, hang on, he's having a little think. Including psychological interventions to treat insomnia and stress. So a standard answer here that's psychological, and remember some of the treatments that we discussed in class are more logical or physiological in that they're medications. So we don't usually talk about those in psychology because obviously we're talking about what we can do to help people without that. So CBT or cognitive behavioural therapy is something that can be used here. So it can be used to treat sleep or stress disorders, and whichever one it is that the question asks for, you need to obviously modify your answer a little bit. But what it does is it combines cognitive therapy. So that's all to do with your cognitions, which are your thoughts and your beliefs about particular things that you have, and the link that they can have on your behaviour and how they can contribute to and affect your behaviour in relation to, obviously in this case, sleep disorders and stress. And so we need to work on both those things, what the thoughts or the cognitions are, and we need to link that in with what the behaviour changes could be to make that person feel better about their insomnia or improve their insomnia or their stress. So psychologists conduct this. The first step that they need to do is identify any faulty cognitions around sleep or stress and start to replace those or think about how we can put them to be more positive or valid. So they might actually not be the right way of thinking. So what the psychologist would then do is combine that with changes in behaviour related to sleep or stress, depending on what the question was asking. So behaviour related to sleep would include all those ideas of sleep hygiene, which when we brainstormed this in class, you guys had a really good knowledge of this. So you would link in some of the thoughts that the person had with making sure they were following some of these sleep hygiene things. If it was stress, you may link in some problem-solving techniques, if it's stress to do with work or school, or another really good thing for stress and the behaviour side of it is to learn about relaxation techniques or do some yoga or have some way to try to lower your stress. So sleep hygiene includes things like, this list isn't exhaustive here, but only going to bed when you feel sleepy, only using your bed for sleep, not working or watching TV or on your phone. Try and keep a regular schedule with going to bed and getting up at the same time. And if you can't sleep, don't start to associate your bed with being awake. Get up, go into another room, come back to bed when you feel tired, and keep repeating that until you're actually sleeping in your bed rather than lying awake in bed. Okay, now some of the applications of this. So we have to look at things like the impact it might have on the road toll, accidents, whether that be workplace or car accidents as well, influence of shift work and jet lag and all of those sorts of things. So a basic understanding of all these ideas is useful. Again, the question will guide you as to what sorts of things you might need to do about it. But generally, if you've got some general knowledge of these things, you should be able to answer the types of questions here. So shift work, I guess the idea is that generally people who are on shift work are awake when they should actually be asleep. So their circadian rhythm is telling them that they should be asleep while they're trying to be working. So to try and minimize this, one thing that can be done is rotating shifts clockwise. So go from day to evenings and then nights and keep that rotation. And if people can stay with the same shift for long periods of time, that's going to be better for them too. Jet lag disrupts the circadian rhythm as well, because where you are at home and where your destination is, the actual light cues and day night are going to be out of sync. So if you want to try and reduce the effect of this, you can, if you're going somewhere for a long period of time, start to eat and sleep on that destination time before you go. And so when you get there, you'll be more in sync and won't feel some of the symptoms that you have when you have jet lag. Sporting performance here can be affected because obviously the circadian rhythm affects your level of alertness as well. So if you are a tennis player and you have a tournament where you have to fly to the other side of the world, but the day and night are different, your arousal level could not be at the right level for you to perform well at that. Now, driving, anything to do with driving, workers, car, workplace accidents, all of that sort of thing. There's some strategies to try and help reduce people feeling tired and having the risk of microsleeps and those sorts of things. The first is to try to get a good night's sleep. If you're driving or working, take regular breaks. Make sure you eat healthy food that's going to keep you going during the day. And this is where lots of government education programs, particularly about driving safety, are very common. Now, a couple others just worth knowing about is SAD, seasonal affective disorder. So it's a type of depression as the day length shortens because that impacts on the circadian rhythm. The amount of light being lower is affecting melatonin production, making more melatonin than what would normally happen, and so the person feels sleepy. And another one that may come up is delayed sleep phase syndrome, because it's quite common in teenagers. So what happens here is the circadian rhythm's actually delayed, so a person doesn't feel sleepy until much later in the night, and they still need to get up and follow a normal schedule by going to school or work the next day, and so they're struggling in the morning to deal with that because their body's still telling them they should be asleep according to their circadian rhythm. Now the next one, personal growth. Well, hopefully you've learned some things that are going to improve your stress and sleep during this topic, but it's not usually a question that gets asked in an exam. And then we have investigation designs and methods. So objective quantitative methods. These are methods of collecting some data that we can measure or directly verify. So as long as you know a couple of examples for sleep and stress that could be used. So I've got here EEG, which stands for electroencephalogram. So that measures your brain waves during sleep. Other things like heart rate or blood pressure are always good responses as well for this, and they could be measured for either sleep or stress. Melatonin levels are a good indication of whether or not you should be feeling sleepy. Cortisol levels are really good for a measurement for stress. Subjective quantitative methods, so this somehow depends now on what the subject is thinking or feeling, and that involves still numbers that we get as a result. So a good example here is the rating scales of the your sleepiness in the Epworth Sleepiness Scale, or the other one is the social readjustment scale for stress. So adding up how many stressful events have happened to you in the last 12 months and giving you a point score for that, which means, you know, you're likely to be more stressed and likely to get ill as a result. And qualitative methods, this involves content analysis of the focus group information or the Delphi technique data that someone has collected in relation to the sleep or stress stuff. Now, standard investigation designs can be included in this topic. They can be anywhere in the exam. So with an experimental design, there is random allocation to an experimental and control group. The independent variable is changed for the experimental group, but not the control group. There's pre and post testing of the independent variable, and then we make some comparisons to see if we can find a cause and effect relationship. So that could involve, you know, white noise treatment to see if it can improve sleep quality or quantity. Quantitative observational designs have pre-existing groups rather than random allocation. So the independent variable is already existing, so it might be certain things we can't change, like particular gender or age, or how many people are in your family, whether you're from a big family or a small family. Those things we can't change, but if we're still interested in seeing the effects of them on stress or sleep, we can put people in pre-existing groups and compare them to find relationships between variables. And qualitative, we can use the focus groups or the Delphi technique to collect data there. All right, now the last one is ethical issues. All the ethical issues apply in every topic that we do in psychology, and they could be asked anywhere. Particular ones, though, that do apply in this one are the fact that people suffering from sleep disorders or stress are a vulnerable group. So really, we need to make sure there is no harm, and we also need to make sure that the informed consent process takes into account that these people are already suffering. So that should wrap up what you have written down on all of the different parts of the exam revision booklet. So these notes you can refer back to for the test and for the exam, and hopefully do really well in the test. All right, see you next time. Bye.